The government is on a mission to accelerate plans for a major overhaul of the public health sector. The developmental changes will take place over time, guided by ongoing periodic reviews of the healthcare system.
I see my job as Minister of Health to review the process, to preserve what works, and to see to what extent we can enhance and improve where the challenges exist.
So the Health Ministry will be working speedily to complete preparation of a 10-year strategic development plan for public health and public health administration. A $250,000 financing agreement for crafting that plan was signed with the IDB and the PIOJ in November 2015. The World Bank is funding another initiative to explore costs and benchmark costing associated with healthcare delivery in various areas.
I'd like to get a feel for whether or not, even with the limited resources, we are spending optimally at the different levels of administering healthcare. The reviews, I'm hoping, over the next 3 to 6 months will at least help to point us in a direction as to where we need to go as it relates to improving the system.
The ministry is also looking to improve its human resource management and will be examining the United States, UK, and Canadian systems to help in that process.
I'm not suggesting that we can adopt in a wholesale way any system to Jamaica, but it's worth examining, and it points to some of the variables that we need to consider and will be considered as we embark on this process of review.
As a policy, preventative healthcare is to be promoted alongside curative treatment. That means equal attention is being paid to addressing non-communicable diseases such as heart attack and stroke, communicable illnesses such as viruses. The link between primary, secondary, and tertiary healthcare is also being strengthened. The primary healthcare system will play a significant role in delivering the services closer to where people live, reducing the load and waiting time at hospitals.
I've asked for time and motion studies to be done in a number of the hospitals, starting with the emergency rooms, accidental emergency. There are a number of reasons why people wait, of course, diagnostic services, etc. But I wanted to start there to try to see to what extent we can reduce that waiting time.
As part of that process, community clinics are being upgraded and equipped to meet the needs of patients. At the same time, government has identified the 6 most overcrowded hospitals, and they will be used as prototypes to test a system for reducing waiting time in secondary and tertiary health facilities.
They've identified the 6 most crowded or overcrowded hospitals. We've identified the clinic that is closer to that hospital, and we're embarking over the next 3 months on upgrading of those clinics. Expanded opening hours, improvements in some of the infrastructure, improvements or additional personnel. And at the same time, we are moving to improving the customer service and the triage service in those hospitals to direct or redirect patients who come in because they are considered to be non-essential. Send them across the road to the clinic.
This shift is expected to be rolled out at other health institutions over time, once sufficient testing has been completed. In this and other areas, public-private partnerships (PPPs) are being explored to help deliver a first-world health system to Jamaicans. The administration of public pharmacies is one area where PPPs are being considered.
It is possible to have the private pharmacies administer public drug. It's done under the Drug for Elderly program, it's done under specific programs such as AIDS, medication and so on. So I've asked the NHF, chaired by Mr. Christaka, to immediately convene a sub-unit committee to look at how, over the next year or so, we can begin to roll out and utilize through some public-private partnership arrangement the public drugs through the private pharmacies.
Public-private partnerships are also being explored for the divestment of some diagnostic services.
If we can strike an arrangement that allows part of that capacity to support the public health system, starting with outpatients, I think it's something that we need to standardize across the board as part of the reform to bring quicker services to the patients in the public system.
The Health Ministry is also looking at greater use of telemedicine to facilitate consultation processes and examinations remotely. Ways to optimize the use of hospital operating theaters and reduce waiting time for surgery are also among the reform measures being pursued to improve patient outcomes and a healthier nation. The government on a mission, securing Jamaica's health, fostering hope and prosperity.